Hi, I'm Lawrence Bergstrom, registered osteopath at Swell Back Pain Clinic and an advanced trained non-surgical spinal disc specialist. We get asked questions regarding IDD therapy, or what is known as non-surgical spinal decompression therapy, as to is it painful? Now, when you're on the table receiving treatment, there shouldn't be any pain at all. We do on occasion, particularly with patients that are suffering sciatic pain, nerve pain down the leg, or radiating pain down the arm, we do notice at times during their treatment, while they're on the decompression table, there will be an increase in nerve activity, because as we're taking pressure from a disc and ultimately from a nerve, it allows more activity within the nerve pathway. So we do see that, and it's always the case that patients find it very bearable on the table. That nobody ever says, I need to stop the treatment. It's so uncomfortable, but they're very aware that they can feel something changing, which is very positive. That's very good, because that tells us that we're influencing the damaged disc and taking pressure off the nerve. Now, can patients be sore after treatment? Yes. As the tissues in your spine are being progressively and gently targeted and stretched, the muscles, the joint receptors, the facet joints, the discs, the connective tissue called fascia, taking pressure off the nerves, all of that has a response within the body. So one of the things that we do to ameliorate this, we say to patients, take it easy after a treatment, don't go digging over the garden, take it nice and gently, and we provide them a reusable, freezable gel pack. They bring it to their treatment session, it goes in our freezer, they have their treatment on the table, and then when they come off the table, we place that cold pack over their low back, and they apply their back brace, and they go home feeling much more comfortable. And we recommend all the time you've got any significant or acute back pain, you're icing your back, you're putting a cold pack on there for 15 to 20 minutes in any 1 hour, and then you put that back in the freezer, allow the tissues, your skin in particular, to warm up back to regular body temperature. And if in any doubt, you can use the sensitive skin on the back of your hand and just place it over the back. Once it feels as warm as anywhere else, then you're safe to apply your cold pack again. There are occasions where patients will have a bad day or two as tissues are adapting. However, that settles quickly. Also, it can coincide at times with other activities. Somebody may be having treatment, they get stuck in a long, a car jam or something like that, traffic jam, and they're stuck in a car for 3 hours sitting, and that healing disc is being compressed and that irritates it. Sometimes we see that patients are doing exercises that we're not aware of, and that's why we're very, very stringent about learning everything that patients are doing, because we set very specific rehabilitation exercises which are spine safe. Sometimes people have done an exercise that's coincided with the treatment and that's irritated the tissues. On occasion, people are actually starting to move better. They've been in chronic pain for so long, they start to move better, they start to do a bit more, and the healing disc combined with the treatment and the extra activity causes a degree of additional strain to those tissues as they adapt, and then they become sensitized for a little while, but that settles quickly. So just to set your mind at rest, IDD therapy when you're on the table should be extremely comfortable. Generally speaking, I would say that overriding majority of our patients, from start through to finish, from being in agony before they came to see us to being resolved or greatly reduced in pain by the end of their treatment journey, pass through with minor soreness, minor stiffness, maybe moderate soreness or stiffness. Some people absolutely cruise through it and never have any discomfort at any point, and they just notice their symptoms getting progressively better. And then a small handful of patients will have a kind of a wave form from being awful when they first consult us to greatly improved or resolved, but their journey's a little bit like this on the pain score. Okay, but we see that every day, and we have very specific protocols and strategies to manage that. So, you know, if you're looking at this therapy and thinking, oh, I don't know, is that a bit painful? The answer is no, it certainly shouldn't be. Thank you for watching.